Nigeria's maternal mortality rate, according to the Nigeria Health Watch, far exceeds the United Nations Sustainable Development Goals target of below 70 deaths per 100,000 live births by 2030.
Maternal mortality, as you all know, is not just a statistic. It is a personal tragedy for families, a setback for communities, and a reflection of health system gaps that we must urgently address.
The key challenges here are access to quality healthcare, funding in rural communities, and lack of awareness at the grassroots.
I would like to use this opportunity to express our commitment as we call to action for the government and all stakeholders to continue to invest highly in maternal and newborn health services, to expand equitable access to quality care, especially in hard-to-reach areas which are most affected by mortality in mothers and newborns.
In a move to tackle this, the federal government has launched national policies and guidelines aimed at transforming maternal health outcomes. These include access to quality care, enhancing prenatal, delivery and postnatal care services, innovative solutions and community engagement. The Health Minister, Professor Ali Pate, while launching the guidelines, said no woman should die while giving life, and safe childbirth must become a national priority.
On behalf of the Ministry, I'm launching key policy and guideline document, which is a co-function of the Federal Ministry of Health to guide states, local governments, and all actors in the sector. And this was developed in an inclusive manner. The Safe Motherhood Strategy for 2024-2028, which is a coordinated roadmap for multi-level, multifaceted interventions to protect mothers' lives. We're trying to expand care for women who have obstetric fistula, but they're not enough, for instance, level 3 obstetricians who can fix those fistula. There are about 2 now they've been trained, and more are in different stages. We have level 1, level 2 trainings. So that guideline will further expand sort of the ability of others to be able to deal with this issue in the correct way. And I'm also proud to highlight that the Maternal and Neonatal Mortality Reduction Initiative, what we call MAMI, we launched it on November 3rd during the Joint Annual Review in 2024. We launched it as a flagship approach to crush maternal mortality. And it's a bold, data-driven strategy that focuses on addressing the 5 critical delays that lead to maternal and newborn deaths. Delays in seeking care, in reaching the place of care, in receiving care, in coordination, and in taking responsibility.
It's also left to the federal government to focus on training of birth attendants and education at the grassroots, which contribute to maternal mortality to improve women's health in Nigeria. Olije Wapera, Arise News.